Bruce Allworth. Bruce is a vet. Bruce is currently a professor in the Livestock Systems and Director of the Fred Morley Centre at the School of Animal and Veterinary Sciences, Sturt University. That's a long title, Bruce. In Wagga Wagga. He basically operates a sheep and cattle consultancy. He's a fellow of the Australian and New Zealand College of Veterinary Scientists and a diplomat of the European College of Small Ruminant Health Management and registered sheep specialists. Bruce's area of expertise is in disease management and prevention, and Bruce is a farmer. It's always good to hear from real people, Bruce. Now, what Bruce is going to talk about is basically the pain relief in sheep and cattle and what we should be doing and the whys and the wherefore. So over to you, Bruce. We'll give you a 10-minute gong. Does that sound right?
Thank you. That sounds great. I presume people can't interrupt as we're talking, which makes the presentation a bit sterile. If people can work out how to interrupt me, that might be good. But sure. Otherwise, I'll give my presentation, then hopefully there'll be plenty of time for questions.
That's great, Bruce. I'll keep an eye out for questions and we'll let you know. Okay?
Yeah, rightio. Well, if people are getting restless, just interrupt me with a question. Might be a good way of doing it. I know these things are a bit trying sometimes.
Very good. Thank you, Bruce.
Welcome everyone. Thanks for having me at your meeting, and I hope it's going well. I'm going to be talking this afternoon about pain mitigation in both sheep and cattle. There's been a few changes over the last 3 or 4 years, and hopefully this will be a useful update for you all. I've started with the key messages, so if you drift off or have something better to do while I'm talking, if you just concentrate for the next minute or two, you'll have everything you need from me. So I guess the most important thing is that the provision of pain relief is now an expectation. I know some of you in the room have probably been involved with marking lambs and calves for the last 30 or 40 years as I've been, and just because we've always done it one way doesn't mean we can still continue to do it that way. And certainly pain relief has to be considered now as part of normal management. And you need to assess whether or not you should be undertaking the procedure that you're doing. And the most important thing is that there are products available that can be used in both sheep and cattle for pain relief. And I'm going to go through, most of the presentation is going to be on those products and when to use them. Probably the worst part of my message is there's not a simple answer, and the more the better, which is probably not what we want to hear as well. All the pain relief products help in some way or other, but none of them are perfect, and the best outcome is when you use a combination of them. We've got two main sorts of pain relief products: the local anaesthetics, which provide immediate relief, as you're all probably aware, but they're very short acting. And the other one is the non-steroidals. So they're the NSAIDs, the non-steroidal anti-inflammatory drugs, and they provide longer duration of pain, but they don't deal very well with immediate pain, which is why a combination of them does provide the best option. As I've mentioned at the beginning, provision of pain relief is now an expectation. You'll all be aware of the Australian Animal Welfare Standards and Guidelines. There's an endorsed set for both sheep and cattle. And they both say the same thing about good husbandry principles, that you need to include an assessment of the need to undertake any procedure, and that undertaking the procedure must be done in a manner that reduces the impact of those procedures. And specifically with sheep, for tail docking, castration and mulesing, it says it should, it doesn't say it must, it says it should be accompanied by pain relief when practical and cost-effective methods become available. And as I think you'll see on our table, there are practical and cost-effective methods at the moment for both of those. And with cattle, it says a very similar thing with surgical procedures should be done with pain relief. So if we have a look at the products, and my apologies, these are quite busy slides, I've realised. As I flicked them up, they looked all pretty mundane when I first looked at them, so I'll let you have a bit of a look at this. We've got 4 products that are now on the market and available in sheep. They are trisulfan, which I'm sure you're all aware of, Numacaine, which has probably got the best marketing I've ever seen, which is the Numbnuts logo. But I don't know whether you can see on the far side, but the little ring on the M that drops down and the little ring over the T on the tail. So that's Numbnuts. There's Buckalgesic and there's Metacam 20, are now all registered in sheep. The reason I'm mentioning sheep here and not cattle is non-steroidals have been available in cattle for years, and most cattle producers, if they've called a vet at all, would have used a non-steroidal. Non-steroidals such as Finidine, which is a flunixin, have been widely used in cattle. Metacam 20 is registered in cattle as well. It's been registered for a while, and there are several different classes of non-steroidals available in cattle. But in sheep, there is only one non-steroidal registered, and given it's a food-producing animal, it's important we use registered products only. So that's been quite a game changer. In terms of when they're used, trisulfan is applied to a wound. Numacaine is lignocaine applied in a specific applicator when you put a ring on, either a tail or on a scrotum. Buckalgesic is provided orally, but it's not an oral drench. It's given into the cheek in the buccal cavity. That's why it's called Buckalgesic. So it's given in the cheek, and Metacam is given as an injection subcutaneously, which again is different to all the other non-steroidal injections available in cattle, which are given intramuscularly. So that's a subcutaneous injection. The major issues, the trisulfan and Numacaine are local anaesthetics, and Buckalgesic and Metacam are both meloxicam. They're both the same product. They're non-steroidals. And the cost of them is around about 50 cents to $1, depending. We'll have a look at these in a bit more detail. Not sure what I did there. So if we have a look at the cost, it's a little bit hard to give you specific costs because the non-steroidal anti-inflammatories and Numacaine are all vet-only products. And that means that it's up to the vet to provide them and set the price, and you need a relationship with the vet, and depending on your relationship, the price might change quite a lot. Trisulfan, on the other hand, is sold through resellers, and as far as I can work out, it's a set price. The resellers don't even get to set it. The company sets it. So it's a reasonably set price, which has just taken a jump, I see, in the last 12 months. So trisulfan works out at, depending on the size of the lamb, around about $1. And if you're using it in castrated, knife castration in calves, it would only be about $1 in calves as well, which makes it very cheap in cattle. Buckalgesic, similarly, with sheep, they're treated at 1 ml subcutaneously per 10 kilos. So it's around about, for Buckalgesic, it's around, depending on the size, about 50 cents or 60 cents, depending on the size of the lambs at lamb marking. And with cattle, it's around about $1, depending when you're calf marking. The price of the Numacaine, if you're giving it 67 cents a dose, unless you're only doing 1 or 2 sheep, but if you're doing any number, it works out 67 cents a dose. Once you've purchased the applicator, I think the applicator retails for about $300 and something, but you need to buy a couple of spare parts so you don't run into trouble. So it usually works out about $400 outlay, and then you set up, and it's 67 cents a dose thereafter. And generally speaking, if you use injectable non-steroidal anti-inflammatories, they would be around about double the cost of the Buckalgesic. But again, that will depend on the price that comes from the vet. I should just say a complete throwaway line here, but if you're treating any sheep that's down for any reason that might involve pain such as mastitis, lameness, or even preg-tox, then giving it a non-steroidal 3 mils for a 60 kilogram ewe under the skin is still one of the better things that we can offer sheep. It just takes the pain out for up to 24 hours, and sheep are pretty stoic, and if that's enough to get them back on their feet, they're usually going to recover a lot quicker. This has nothing to do with pain mitigation talk that I'm meant to be giving, but that's just a throwaway line. I've been asked to talk about the cost benefit of pain relief.
Excuse me, Bruce, can we just pause there for a second, please? Can I just ask any questions on what Bruce has just covered? You mentioned non-steroidals frequently. Can you just explain the significance of you saying that, please? Yeah, I'm just going to flick to a slide here on non-steroidal anti-inflammatories. Non-steroidal anti-inflammatory drugs have been around for years. They just have not been available in a form that we can use easily in sheep. So you know them as Nurofen or Voltaren, something you probably jump to if you get a severe pain or injury. And in cattle, they're Flunixin. And they reduce inflammation, they reduce pain, and they potentially reduce fever. And they do that through blocking the release of prostaglandins, or the synthesis of prostaglandins, which then stops the pain signals. So they don't necessarily stop the action that's happening, but they stop the pain signal being sent, so that takes the pain away. They take about 15 to 30 minutes to take effect, so if you're looking at the TV last night and you saw that ad for Nurofen Zavance, I think it is, in the liquid form that's much quicker. I think they might get it down to 6 or 7 minutes, but when you take a Nurofen, it usually takes about 20 minutes before you start getting that effect. It's exactly the same in sheep. Interestingly, in terms of castration, most of the pain that Nurofen is going to drop to take usually takes around 30 to 40 minutes to start kicking in. Meloxicam, buccal-gesic or Medicam does not stop immediate pain, but it does provide pain relief for around about 9 hours. The video that's available suggests it might be up to 3 days. The published work shows that between 6 and 9 hours it's probably at its peak, but there have been reports that there's still some effect 24 hours later. Thinking that it's helping out the 3 days is probably a bit of wishful thinking in most cases. So hopefully that addresses the issue on the non-steroidal anti-inflammatory drugs. And as I say, in sheep, we've got buccal-gesic and we've got Medicam. I see I've taken the photo backwards there. That wasn't very clever, down the bottom. And in cattle, you've got a range of products that your vet can provide. But again, buccal-gesic is registered and is by far the cheapest and easiest to administer. Thank you, Bruce.
Pleasure. So just in terms of I've been asked to mention the cost benefit of pain relief. And I'd love to tell you that it's going to save you lots of money by giving pain relief. It's not going to make much difference at all in terms of production benefits. When trisulfan first came out, I did a large trial on 1,300 lambs, and we found no benefit 4 to 6 weeks later, and it's exactly what you expect. Sheep and cattle are quite resilient animals, and when they do suffer pain and lose weight as a result of it, they usually catch up if the feed is on offer is good over the next 2 to 4 weeks, so that by 4 to 6 weeks, there's often not much difference in terms of production. Despite that, most producers I know that have used pain relief don't go away from it, even though there's no specific benefit. And there are lots of intangibles and possibly tangible benefits in terms of protecting your markets. Essentially, you may have trouble marketing your animals in the future if you're not using pain relief. And already there are some programs within companies, I've signed up to a few of them, where if you're using pain relief, you get a premium on your product. So that's up to individuals to negotiate those things. So there are certainly some financial benefits. The main issue is that it's really a requirement of best practice these days to do it. But it is going to be an added cost, but it will allow you, and to market your products more easily and potentially protect markets. Just a little word on terminology. This isn't too critical, but anesthesia is what we term about loss of physical sensation, whereas analgesia is the term used around pain relief. So anaesthetics are also analgesics generally in that they stop the pain relief, but you don't get, with true analgesia, you don't get total loss of feeling like you do with anaesthesia. And the other two bits of word terminology that's used, Alison Small from CSIRO is particularly big on these ones, is immediate or fast pain and chronic or slow pain. Now, I'll just pause there and say most of us think of chronic pain as something that's been going on for 3 to 4 months if you've got a bad back. I'm sure none of you have got bad backs. But if you happen to have a bad back, you're thinking chronic pain 3 or 4 months. What we're referring to here is chronic is longer term than immediate. So we're talking hours and days, not months here, just as much in terms of chronic pain. And when you conduct a painful procedure, such as castration or mulesing or tail docking, you get both fast and slow pain for the animal. So there's an immediate pain, and then there's a different type of pain that is ongoing associated with the procedure. And most people consider that pain probably goes on for about up to 3 days, and it's even been measured for potentially longer than that. Obviously, with mulesing, depending on the wound healing, they can look slightly painful for a number of days. So the two products we've got, the two types of products are either local anaesthetics or the non-steroidals. In terms of local anaesthetics, Novocaine is applied with the ring. And if this was a group of producers, I would have run a survey here just to see how many people were using either pain relief or the type of marking and mulesing that they were doing. But essentially, it lasts for less than an hour, so it deals very well with the immediate pain. And trisulfan and Novocaine is also applied prior to the pain occurring, so it really is the ideal thing for pain mitigation in terms of ring castration. Trisulfan is applied after the wound has occurred or the pain has been inflicted, but it does have lignocaine in it, along with a longer-acting local anaesthetic. So it's got two local anaesthetics in it, lignocaine and bupivacaine. And it also has adrenaline, which increases the speed that the local anaesthetics work, as well as inhibits or minimises bleeding. And it's got cetramide, which is an antiseptic in there. It gives very good pain relief in the first 2 to 4 hours after the wound. But generally speaking, by 6 to 8 hours, it's not having much effect. It does stop something called wound hyperalgesia for 24 hours, which is when you touch the wound, it's not as sensitive, but the animals still experience or demonstrate pain behaviours when they're after they've been mulesed, even if they've had trisulfan from about 6 hours onwards. In terms of the non-steroidals, I've mentioned most of this in answering the question. They take longer to act, and this is why it ends up, the recommendation is that you go for a combination. They're better at dealing with the more chronic or the medium-term pain. They don't do anything about the immediate pain. So let's have a look at the approach to pain mitigation. We've got a few sheep there in the bottom corner there that all wanted to thank a farmer. So they all lined up for me, and we were able to get a bit of a photo there to thank a farmer. I don't know if anyone's seen that website. That's our property here where we run sheep. I had to put something else in which had green in, so there's some cattle in the winter just to show that it does rain here as well. In terms of mulesing, trisulfan and buckalgesic will provide the best pain relief. Trisulfan provides a faster, less prolonged response, which we've just discussed, and buckalgesic gives the longer term response. So the combination is what would be recommended with mulesing. Metacam, as I've mentioned, similar to buckalgesic, And even when the pain, even if you apply both products, when they both wear off, there will still be some pain. So it's not pain-free. We'd like to promote it that it is pain-free, but obviously there's no analgesia occurring when the mulesing is occurring. So there is pain. It's a little bit like going to the dentist and they say, would you like to have, will I give you some local after I pull your teeth out, or will you just go with Nurofen? And I'm guessing you're going to say I'll have the local beforehand, but that's not something that's available in terms of mulesing at the moment. I'm not sure whether over in WA anyone's using liquid nitrogen. It's got a bit of a following in Victoria. If there's any question on that, I've just put a note there about liquid nitrogen, which is still a painful procedure. And meloxicam's reported, which is buckalgesic, has been reported to have limited benefit, but it's still being currently evaluated in terms of so I haven't got any recommendation there.
Bruce, could you just explain the liquid nitrogen procedure, please?
So there's been a number of alternatives AWI has followed through with, or independent people have done to try and find an alternative to mulesing. One of them was sodium lauryl sulfate, and that's not currently available. One of them was the clips, and that's not currently available. One is using liquid nitrogen. You people probably can't see there, but I'm a redhead, so I know a lot about liquid nitrogen. And that's used obviously in medicine for skin problems. And the idea is that you freeze the cells around the breach, and people think that that's going to be, and almost certainly far less painful than mulesing itself. But whether it's still considered acceptable by the consumers is a much different question. And so that's being Guy John Steinford has patented that and is using it in a number of flocks in Victoria. So castration of lambs, excuse me, interestingly, the information is that ring castration is kinder than knife castration. So if you have to do anything in terms of castration, with most of us do in terms of our lambs, then you probably would be favouring ring castration. I think the last figures I saw across Australia, I don't know for WA specifically, was about 97% of people use ring castration these days. So the majority of people are using ring castration. If you are using it, then excuse me, numbnuts in the form of Numacaine does provide very good short-term relief. You can't use trisulfan because there's no wound to apply it to. Applying a local anaesthetic without exposure does not do anything at all. They did try soaking rings in local anaesthetic, all sorts of things, but generally you have to have a wound for trisulfan. The non-steroidals have not been shown to decrease behaviour responses, although they certainly improve cortisol response. And we would expect over time that more trials will demonstrate that there is an effect from the non-steroidals on the longer term pain that animals definitely experience with castration after that immediate numbness that you see them lying on the ground about 20 minutes after you put the ring on. That is covered very well by lignocaine, and whether the non-steroidals provide further is still a bit up for debate. But we think the combination is probably the best approach. If you are surgically castrating, then you can use trisulfan, and certainly non-steroidals are also useful. So a combination of meloxicam and trisulfan would be best. Excuse me. In terms of tail docking, hot iron is considered the least stressful. The order of pain is hot iron, then rings, and then cold knife. The local anaesthetics certainly decrease behaviour responses to hot iron docking, but trisulfan, which has got the local in it, isn't as effective on the cauterized tail using hot iron docking. So my main recommendation with tail docking is that to use a hot iron. And then if you're castrating at the same time, then obviously using something like a non-steroidal is probably going to be very helpful. So I'm just going to pause on this for the moment. This is probably the most useful table that I'm presenting of all the tables. The others, you can easily find out the cost. This is just a table I've written for this presentation just to try and get it down. And it goes through every combination, but people don't just dock the tails. They usually dock and ring. Obviously, the ewes, they might just dock the tail. People don't usually just mules. Most people do it at lamb marking time. So there's usually a number of operations going on. So what you do is you just go down the list and have a look which operations you're going to be doing. I've bolded the 3 ones that are the most common by far across Australia, but of course an individual producer might be doing something different. But we would generally be saying the least painful procedure is hot iron docking and ring castration, plus or minus mulesing, obviously. And so that's why that features strongly. Some people may ring dock at the same time as ring castration. There are very few people that would also ring dock at the time with mulesing just because the tail's still there. So I've put those in, and obviously a combination comes out to be the best. And if you were hot iron docking, ring castration and mulesing, then you could use the whole suite of what's available. Now, whether people will do that at the moment, that depends who you're talking to. What our job is to tell people what's available and what's best and let them choose. I am concerned that people will start to throw their hands up and say it's all too complicated. It was easy when there was just trisulfan. Now I've got to make a decision. But if you can arm them with this information, they can start doing it. And perhaps the first year they're doing something, they might only use one pain relief. They then see that it fits into their operation quite easily. And the next year they might broaden it to a second one. Or they might find that they can do 2 at once, or they might just stay at 1. Again, it's apart from Victoria, there's no mandatory requirement at this point for it. So it's not legal, but it's certainly an expectation. So hopefully you're going to get those in a format available to you. Just that table might be useful when you're discussing things. So obviously we think meloxicam's suitable under any circumstance because it provides a longer term pain relief, but it doesn't address the initial pain. Trisulfan's suitable where there's a wound, and Novocaine is useful where you're putting on rings. So it's all pretty simple. And I think that slide just summarises all of that. If you were mulesing and castrating, then I'd be suggesting hot iron docking and ring, using pre-op buccal-gesic, hot iron tail docking, the ring with numbnuts, and putting trisulfan on the mule's wound. Now that might sound like a lot. That's not a lot. It's one extra to what most producers would be doing now. Our information is that around 85% of producers who are mulesing are using trisulfan. So the only addition now would be to add in a buccal-gesic. The numbnuts, it's virtually, I've been using numbnuts the last 2 years. It's virtually the same speed as putting on a ring. The applicator is actually easier than the normal ring applicator to put it on, in my view. The difficulty is every 60-odd doses, every 60-odd male lambs, you've got to turn around and put a bottle on a vaccine, you know, and like changing a vaccine or whatever, you've got to put a bottle on, and that slows you down in that circumstance. So it's slightly slower from that perspective. Every 60-odd lambs, you've got about a minute or two hold up. If you're tail docking and castrating, prime lamb operation, or you don't need to be mulesing, then pre-op buccal-gesic, hot iron for tail docking, and applying a ring with numbnuts would give you the best, be able to tick all the boxes to say you'd really done everything that was available. And as I say, if that doesn't suit your system, look back through the table and see what suits. There's just AWI commissioned a review of all the main players in Australia. Alison Small from Cyro, Andrew Fisher down at Melbourne, and Carolyn and Ian as well. And what they said was that local anaesthesia is great acutely, but it's short-lived. Non-steroidals will add to it, and a combination is really what's being recommended. So, sorry if slides just flicked there. So I think I've hammered that point. I just want to speak briefly about calves. It's a little bit more complicated with calves as to what to do. You'd think it's all pretty straightforward. Again, the information is that ring castration is less painful than knife castration. If you're using knife castration, it's pretty easy. You can at least put on trisulfan. There's numbnuts is not available in cattle, and if it becomes available, it's likely you've got to put animals through the old calf crush, which people may or may not be using. I haven't used a calf crush here for about 38 years. I think I worked out the other day. I mean, we do everything standing with our cattle for marking, and we think it's much easier and quicker and better for the calves. The problem with the numbnuts applicator is if you stick it on its head, as you have to do to put it while you're standing, then it doesn't draw up the liquid. So numbnuts isn't available. Buccal-gesic hasn't been shown to be really effective with ring castration, and that's a bit of a surprise, but there's been a couple of studies that suggest that it's not as good as we would expect it to be. I'm going to come back onto that point. For surgical castration, obviously you can use trisulfan. It does slow it down a little bit, and meloxicam certainly provides some relief in addition with trisulfan. You will see on the label of Buccal-gesic, remember this is the same label that we're using on sheep. It's only registered for routine, for the procedure of castration in calves in conjunction with administration of local anaesthetic at the surgical site. So that means that it's not really particularly available at this point in time, even though it is. My feeling and what I do with our cattle is I still use Buccal-gesic. I think it's the best available thing at the moment. I should say here that I don't have any shares or any interest or anything ever to do with the company that developed Buccal-gesic. I've just looked at this from a producer point of view and decided that's what I'm going to do. I've signed on to one of the company programs, Never Ever, that requires me to provide pain relief. And I believe that I'm doing the best I can, but the information is it's by no means perfect. So at this point with calves, if you're using ring castration, then I'd be looking at Buccal-gesic as the pre-op, and surgical castration, I'd use trisulfan and Buccal-gesic. I mean, these products, for the cost of a calf, what they're worth at the moment, they're worth $1.50 you're applying to them. I mean, we're using IBR vaccines, those sort of things at $7. You know, it's a relatively cheap investment with the cattle, in my view. And I've just got a note down the bottom about alternate practices. There's no established pathway in commercial beef production for entire males at this stage. So we're not advocating in any way that people not castrate their animals. Although you should note that by castrating them, you make them lighter by 10 to 15%, and they go to fat a bit quicker. So maybe it's something over time. But with our production system, I think in cattle it's a way off. In sheep, it's a bit of a different story. So I'm just going to finish on alternate practices. Obviously, mulesing's the big one. I'm happy to answer questions on it, but obviously breeding and dag management, there's some terrific resources. Jeff Linden has done a terrific job at AWI. I take my hat off to him at trying to get information on how to best approach a non-mules flock. What I would strongly advocate is you don't just stop mulesing, but you work out a program if you are going to stop mulesing. And there's a really good article on the fly boss under mulesing as well that you might want to access. So they're very accessible, Jeff's article and the fly boss one. In terms of castration, I went to Canada in May 2019. I was very keen to see what they were doing about castration. They weren't castrating any animals. And I say this very quietly because I don't want it really publicised, but I ate one of the best pieces of lamb I've ever eaten there, and I sat next to the guy who'd produced it at the dinner we had, and it was a 50-kilogram male animal, and there was just nothing in it. The New Zealanders have done a lot of work on meat taint, and it doesn't appear to be a big issue if lambs are well grown and finished early, even if they're post-pubertal. So we're talking about getting lambs off at 6 to 8 months. If you've got good growth characteristics, most producers certainly in southern Australia would be able to meet those specs. MLA actually asked me not to put anything on this, but I just thought it was useful. I'm not advocating anything here. I think it's just a space to watch. We're taking a group of animals on a research project next year through comparing wethers with rams just to see what the roadblocks are. We've talked with the abattoirs, and obviously they would prefer just one type. So if everyone's wethers, they're fine. But if they said if everyone was rams, they'd be fine as well. The obvious issue with rams is the management issue if you get caught holding them for too long, because they're certainly going to be sexually active, these well-grown lambs, by about 4 to 5 months of age, depending on the time of year. So that brings me to the key messages, and I'm really keen just to answer any questions. And I know I've hammered just a couple of points there, but I hope everyone's found that useful, and I think I can end it there.
Thank you very much, Bruce. Phil. Hang on.
Couple of questions. Pour on flunixin for cattle. I've heard that's possible in the US. Any experience or knowledge of that?
No experience or knowledge. It's not currently registered here, so until we get that, that would be what we've got to wait on.
Okay, and the other one is Metacam. Doesn't seem to be recommended much. What's the reason for that?
I think Metacam is recommended a lot. It's not recommended as the go-to. Sorry, I'm getting a lot of feedback there. It's not recommended as the go-to at lamb marking only on a cost basis, in that it costs about double. Most producers say to me they'd prefer to put something into their mouth than to be handling another needle, in that at lamb marking they're already giving at least 1, 2, or possibly 3 vaccinations. And even though you can get the dual vaccinations if you're giving Erivac or something, it's still a lot of juggling around, and they just find that easier. I would think, as a producer, I now think I'm remiss if I don't have a bottle of Metacam 20 sitting on my shelf for almost every other problem I deal with sheep, other than with castration and docking. And I've concentrated my presentation on castration docking. It's the identical product. It just comes down to cost and what you want. If a producer's happier to be vaccinating, then it's easy to set it up and do it. It just costs, depending, again, your vet might say, look, I'd prefer you to be setting up with a vaccine. They might provide it at a lower cost price to them than the buccal GZIC. But as a vet, I can buy both, and I can tell you that we have to pay more for the injectable at this point in time.
Yeah, Bruce, a long time ago there was some research into cryptorchids in merinos. Did that ever go anywhere? Cryptorchids, where they tuck the testicles inside the body using the ring. And secondly, in my travels, I've noticed that the survival of wether lambs seems to be often to be less than the survival of ewe lambs, on the assumption that they're a 50-50 split in the first place. And I always put that down to the ring itself. Is that data available more widely?
I haven't seen that data. I also haven't seen data on the 50-50 split. We did a research project looking at the effect of feeding grains on the split of lambs, and it was interesting when we actually drilled down on the numbers, we rarely got a 50-50 split. So I don't know whether that's actually a result. There's usually a few more females than males to begin with. But if somebody's looked at the numbers at marking and then looked at weaning, that would be interesting. I haven't seen that detail. In terms of the cryptorchids, you're absolutely spot on. I'm pretty sure it was the mid to late 80s. There was a lot of work done on the cryptorchids, and I don't know why it hasn't dropped off. And that's one of the things we're going to be looking at as well. in that it gives you the extra growth without the risk of the fertility. The difficulty is that you still got to apply something to it so it doesn't meet the criteria of leaving the animal alone, which by 2030 is maybe what we'll have to be meeting the consumer with.
Thank you, Bruce.
Great questions, thank you.
Bruce, while I'm walking, can you, just the age of mulesing, have you got any thoughts on the youngest and the oldest age that's reasonable to muse a lamb?
I see it's not part of the animal welfare and guidelines, so I have to be very careful here. I'm director of the Fred Morley Centre, and Fred Morley said to me one time, he said, so long as the ewe has licked the lamb, it's not too young to mules. The issue with mulesing is that the younger their mules, the less it comes off, the quicker they heal, the better it is. A better job is done at an older age. There's no doubt about that. It's quite difficult mulesing very young lambs. Most producers, and this is a bit of a hobby horse of mine, so you have to be careful we don't go off track here, but most producers lamb for slightly too long, and I mean, there's really no excuse if you're lambing after probably the 15th of February to be having the rams out for more than 5 weeks. It's a matter of basically when you're going to be getting the lambs in, but I would think between 1 week and 6 weeks. I think combining it, the younger you do it, if you're going to mules, the more effective you've got that over that first going into the first spring and summer with the fly attack. It may as well be done then. And my understanding is that the younger that things happen to animals, the less likely they are to remember that pain as well. Did that answer the question, or did I just talk around it?
Yep, that's good. Bruce, do you have any idea on when pain relief may become mandatory in WA?
Absolutely not. I don't know a lot about politics. I thought you were going to open the border a few weeks ago, and I've been totally wrong on that. And I thought Queensland was going to open their border. So if you want to ask a political question, you need to ask the politicians. My understanding is it's only mandatory in Western Australia, in Victoria. I live in New South Wales. I'm 12 kilometres north of the border from Victoria, and we've been told it's not going to be mandatory here in the foreseeable future, but parliaments change. It's really depending who gets into what parliament as to what happens. So somebody in the audience probably has a much better idea of what's happening in Western Australia than I do.
No one's volunteering. There's one more question over.
In some of the projects that you've been involved with, how have you measured the response of the animals to the pain relief in terms of the animal behaviours? I heard you in one of the slides you had blood cortisol, but I was just interested if you'd used accelerometers or any movement devices to capture animal behaviour.
Yeah, great question. And I should have prefaced this and put it all up front. I've been asked by MLA to review everyone else's work, and apart from that trial of 1,300 lambs that I did as a farm trial on my own farm, I haven't done any of this work on these products. I've just used them as a producer and as an advisor, so I haven't done any of this. Alison Small and Andrew Fisher have done a lot of the work, and there's been a tendency in the probably around 2000 onwards, people have changed more towards using animal behaviour rather than measuring things like cortisol levels, which are really complicated when you do get wounds as well. So most things are with animal behaviour, and accelerometers, we're really looking forward to how they're going to change the game, because at the moment what we do is we use cameras and then we use students, and they sit down and they look at 72 hours of films, and they can only bear about 30 or 40 animals to analyse the data. It's really painful going through and looking at hour after hour of video of lambs and assessing what they're doing at what times. So it's been a pretty hard slog, and I think accelerometers will make a big difference, and particularly things like distance from the ewe, grazing behaviour and those things return to normality. But I don't think any of it will change the fact that there's going to be some pain associated with these painful procedures, and we need to address that in some way.
Thank you.
Thank you very much, Bruce. I think we'll leave it there. Look, thank you very much for joining us over here, and The best thing about New South Wales and Victoria and Queensland is it's over there and we're here. So
Well, I'm really sorry I couldn't come over, but I definitely couldn't. I did ask your Premier and he said no.
yeah, good. Yeah, and we're very happy, thank you. So
And you've heard me coughing in brackets with asthma, and you're very glad I didn't come over.
yes, yeah, asthma, so you say, yes. Bruce, thank you. It's always good to hear from a vet who's got a sense of humour and also knows what they're talking about. So much appreciated, and wish you well, and maybe next year we'll see you.
Terrific. Okay, bye for now.
Thank you.